Viral hepatitis. Hepatitis is an inflammation of the liver. The condition can be self-limiting or can progress to fibrosis, scarring, cirrhosis, or liver cancer. Hepatitis virus are the most common cause of hepatitis in the world, but other infection, toxic substances, alcohol, certain drugs, and autoimmune diseases can also cause hepatitis. There are five main hepatitis viruses referred to as type A, B, C, D, and E. These five types are of greatest concern because of the burden of the illness and death they cause, and the potential for outbreaks and epidemic spread. In particular, types B and C lead to chronic diseases in hundreds of millions of people, and together are the most common cause of liver cirrhosis and cancer. Hepatitis B and C and D usually occur as a result of parenteral contact with infected blood and fluids. Common modes of transmission for these viruses include reception of contaminated blood or blood products, or invasive medical procedures using contaminated equipment. For the hepatitis B, transmission from mother to baby at birth, from family member to a child, also by sexual contact. Hepatitis A and E are typically caused by ingestion of contaminated food or water. Hepatitis A virus is present in the feces of infected person and is most often transmitted through consumption of contaminated water or food. Acute infection may occur with limited or no symptoms, or may include symptoms such as jaundice, yellowish of the skin or eyes, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. Hepatitis B virus is transmitted through exposure of infected blood, semen, and other body fluid. HBV can be transmitted from infected mother to infant at the time of birth, or from family member to infant in early childhood. Hepatitis C virus is most transmitted through exposure to infected blood. This may happen through transfusion of HCV, contaminated blood, and blood products. Contaminated injection during medical procedure and through injection drug use. Sexual transmission is also possible, but is much less common. There is no vaccine for HCV. Hepatitis D virus infection occur only in those who are infected with HBV. The dual infection of HDV and HBV can result in the more serious disease and worse outcome. Hepatitis B vaccine provides protection from HDV infection. Hepatitis E virus is mostly transmitted through consumption of contaminated water or food. HEV is a common cause of hepatitis outbreak in developing parts of the world and is increasingly recognized as an important cause of disease in developed countries. Safe and effective vaccines to prevent HEV infection have been developed but are not widely available. Thank you.